Supplements. Supplements are, a question I get every day. Like, do I really need to take supplements? Okay, so supplements are minerals. Yeah, they're minerals, they're nutritional additives that you take to boost yourself. There's usually a misconception because sometimes we think we are taking this supplement so that my baby can get it. But what actually happens is your baby gets from your body and from your reserves. So the supplement is actually for mom, not for baby. Yeah, if you never took a supplement and you did not eat well, your baby will take everything in your body and get to the reserves and drain you out. So what are these supplements? Iron, calcium, magnesium are the most common. And why you need iron is because it's what boosts your blood. Now you will share a bit of your blood with your baby and you will keep, pumping the blood to the baby. So you need your own blood to have enough iron so that you have in excess so that you push it to the baby. So the baby also has good enough iron. So that's why you take iron as a supplement. Calcium and magnesium work together. They are mostly for the bones and for the muscles. Now again, like I said, this is for you because your baby will form their bones and form their muscles from the calcium you already have in your body and from your stores. So you replace your own. Now you can tell you have a deficiency if, for example, for iron, you're getting dizzy spells, you're getting headaches, you have fatigue. Then you need to have your iron checked. And when you go to your midwife or doctor, they will check you and sometimes you're pale and they will comment and say your hands look a bit whitish or your tongue looks whitish. They check even your eyes. And if they find that you're low on iron, then they will give you a supplement for that. At the beginning of your pregnancy, all these things are checked just to make sure that you're fine, but it doesn't mean that they can't, reduce as you go along. And so if it's found that it reduced, then you get a supplement. For calcium and magnesium, if you know you have a deficiency, you'll end up getting cramps, especially on your calf muscle, that's on your legs. When you wake up first thing in the morning, you get up and you have this cramp and your feet can't, take you to where you're going. That is a deficiency. And then what you need to do is boost. Now, if you are boosting, of course you have two major pathways: eat or take the supplement. If you can eat, better for you. If you can't eat, then supplement. Sometimes you have to do both because maybe you're eating and you're not getting enough of that. And that is something you can be guided by your doctor or midwife. Now, not every woman needs supplementation. As long as you're eating well and you're eating healthy, you will be good. When do you need to take this? The ideal is actually to do it before pregnancy, because for some women, the supplements actually make them sicker. They worsen the morning sickness or the evening sickness, and you don't want that. So again, if you were able to roll back and you're, earlier before pregnancy, please take them like 3 months before when you plan to have yourself get pregnant. But if you're taking them in pregnancy, the first 3 months is when you really need them if you are not eating well. But the problem comes when you're not eating well and the supplements make you nauseated. So where do you go or what do you do? And my take is small meals, small frequent portions of food will help sort that out. Don't wait to have breakfast and then have lunch and then have dinner. Just take a small meal. You can divide your breakfast into 2 portions or divide your lunch into 2 portions, but it might make you feel like you're an eating machine, like you're constantly eating, and people at work will be wondering, okay, nowadays she just eats all the time. But it really doesn't matter, you're achieving something. So that's my take on supplements. You can avoid them if you're eating well. If you have to have them, then you have to have them and take them in the first 3 months. Now, that reminds me of, a common question in regards to what other medicine am I allowed to take in pregnancy? Can I take antibiotics when I have a urinary tract infection? Can I take a cough syrup when I'm coughing? And the truth is, in pregnancy, you want to avoid medication as much as possible. Only use it when it's necessary. There are things you can treat with probiotics. Like if you have a urinary tract infection and you commit yourself to drinking a lot more water than you usually do for a day or two, and then take things like, yogurt and a boost with, a lot of vegetables and or fruits, you might actually be able to kick out the urinary tract infection. And then ask yourself, why is the urinary tract infection coming? Is it because I'm not drinking enough water? Am I holding urine for so long? And correct that. If you're not drinking enough water, drink a lot of water. If you're not emptying your bladder frequently, every 2 hours, don't go beyond that. Just empty your bladder, but keep off medicine as much as you can. Ginger, lemon, garlic, honey concoction works very well with common colds. So take that, especially when you think something is about to happen, start taking it. It will actually put the symptoms down and help you recover much faster. Thank you and keep well. Subscribe and get in touch. So one day, Dad comes and tells me his ordeal. The previous week, the wife had wanted pineapples. So they lived somewhere in Eastlands. It was 10 p.m. There is no way he would have found pineapples anywhere because the markets are closed. So he had to drive round the city looking for a hotel that is open so that he can get pineapples for his wife.
We're sorry, the number you have dialed is not in service at this time.